Good morning, everyone. Gemar Tov, and thank you so much for joining us for Spirit, the stimulating program initiative for retirees that inspires thought. I'm Judy Steinig, Director of Community Programs for the Orthodox Union, and it's my honor to coordinate and host this program. Spirit started a few years ago as an on-site program, and now we're happy to present it as an online program for baby boomers, empty nesters, retirees, not yet retirees, sandwich generation parents, and seniors. Everybody who's looking for educational, intellectual, and spiritual growth. Now, during the pandemic, everybody is still sheltering in, and Spirit has become the perfect way for all of us to engage together in a virtual setting. Today, we are very happy to welcome back Dr. Shmuel Shields, a certified nutritionist, educator, and clinician who spoke a few weeks ago on how to boost our immunity with minerals and vitamins. You can find that presentation after this one in the archives. Today, he is returning to discuss nutrition for a healthy brain and memory. Dr. Shields is also the author of L'chaim, 18 Chapters to Live. It is an honor to welcome back Dr. Shields and to turn the Spirit Forum over to him. Thank you so much for joining us.
Okay, thank you, Rebbe Steinig. Welcome everybody to the program today. My name is Dr. Shields. I am a certified nutritionist. And as Rebbe Steinig mentioned, I am the author of a book called L'chaim, 18 Chapters to Live By, which is a book on health from a Torah perspective, each chapter devoted to another aspect of health. And as a matter of fact, I am going to be using some of the material from my book today in this presentation, along with some other material as well. So I hope everybody will get a lot out of this program. I know it's a very stressful time for everybody. We're between Rosh Hashanah and Yom Kippur, and we're also concerned about the spike in some of the corona cases we're hearing about. So I'd like to start off with a little story just to cut some of the tension today, okay? So the story goes like this. There was a young lady that walked into a local library. She took out a book, and the very next day she came back and returned the book and told the librarian that this was the worst book she ever read in her life. A terrible book. So the librarian was very curious and said, "What was wrong with the book?" So the young lady said, "It had too many characters and no plot." So the librarian turned to her and said, "So you're the one that took our telephone book." Okay, anyway, I thought you would enjoy that. I could assure you that my book, L'chaim, 18 Chapters to Live By, it has a plot and it doesn't have too many characters. But in any event, we have a very important topic today. We're going to talk about the health of the aging brain and what we can do to keep the brain healthy as we age. And I think David HaMelech says it best in Sefer Tehillim. I don't have the exact pasuk in front of me, but he says, "Through my flesh, I see my Creator." In other words, we should marvel at the human body and how miraculous it is. And since we're talking about the brain today, I just want to tell you that research says that it would take 3 Empire Statement Buildings. Imagine 3 Empire Statement Buildings and to do what the human brain can do. We'd have to have those 3 Empire State Buildings filled with computers to do what our small little brain can do. It's absolutely miraculous. Now, I also want to tell you that the brain needs a lot of power. It needs fuel, and it depends on the nutrition we give it. The amino acids, the vitamins, the minerals are essential for producing the chemicals in the brain called neurotransmitters. That allows the cells to communicate and for the brain to do the work that it has to do. In order to satisfy the brain's enormous need for nutrients, every time the heart beats, 25% of the body's blood, oxygen, and glucose is sent directly to the brain with each heartbeat. In fact, the brain has a higher concentration of nutrients than any organ in the body. And even a slight deficiency in something like vitamin B1 or B2 or B6 or B12 or folic acid can create irritability, mental confusion, sometimes depression, emotional instability, and a deficiency in the mineral called magnesium can sometimes cause hyperactivity, insomnia, confusion, and irritability. So the way we feed the brain is very important. And that's what we're going to spend more time talking about today. Before we do that, I'm just going to ask Rebbitzin Steinig just to put up the tips for a healthy brain and memory, just to show you a little bit of an outline of some of the things we're going to touch on. So I'm going to keep talking as she does this, but you will see the, okay, there we go. So hopefully everybody can see that. These are some of the things we are going to touch briefly on. Again, each one of these things could be a topic in itself, but hopefully we will see how all of these things can affect our cognition. Okay, we'll come back and touch on these in a couple of minutes. Okay, let's take a look at the other slide now. If we can just show the other slide as well. Okay, so I want to just, if we can scroll up a little bit. I want to see the bottom half of the slide. Okay, right there, perfect. So these are, if you look at the bottom here, this is from Harvard Health Publications, 6-step summary for cognitive health. So here they are right here. Eat a plant-based diet, exercise regularly, get enough sleep, manage your stress, nurture social contacts, and continue to challenge your brain. Those are the 6 steps that Harvard Health Publications recommends for keeping the brain healthy. Obviously, we don't have time to talk about all of these, but we will touch on these and spend most of the time talking about nutrition. Okay, we could take that slide down now. Okay, so when it comes to feeding the brain, we know if there are any people that do any baking in the audience, when we want to bake a cake, I gave an example last time when we talked about immunity. If anybody was watching last time, you might remember, when it comes to baking a cake, you need a certain number of ingredients. If you're missing something, you're missing one of the ingredients, you may get a cake, but it's not going to be as tasty. It might not have the texture you want. It's not going to be quite as good. It's the same thing with the human brain. If we are missing one of the nutrients that are important to make the neurotransmitters or to help keep the brain functioning properly, our brain function will be compromised in some way. So we're going to learn very soon what would be the best way to feed and nourish the brain. So let's talk about that. Let's go into that right now. And what I want to show you is that much of the research today has shown that there's a particular way of eating that is very good for the health of the body. And if you want to have a healthy brain, you need to have a healthy body. We have to try to promote the health of the body. And one of the best ways to promote the health of the body is to eat a Mediterranean-style diet, the Mediterranean way of eating. It's not really a diet, it's more of a lifestyle. And it's the way that the countries that surround the Mediterranean Sea tend to eat. And there's been research for decades on this particular way of eating, and it has shown to be beneficial for not only our physical and cardiovascular health, but also for the health of the brain. There was a study done by Tufts University, says eat like a Mediterranean to protect your aging brain. And we're going to talk very soon about what the Mediterranean way of eating is. But one of the researchers has stated, David Knopman from the Mayo Clinic, that research has shown moderately compelling evidence that adherence to a Mediterranean-style diet is linked to less late-life cognitive impairment. So we can have better cognitive functioning later on in life if we adopt this Mediterranean way of eating. And I want to tell you a little bit about what the Mediterranean diet entails, and then you may want to incorporate some of its principles. Just by a show of hands, for people that I can see on my gallery, how many people have heard of the Mediterranean way of eating? Okay, many people have. Okay, for those of you that are not that familiar with it, one of the things I pretty much recommend this way of eating to most of my patients because I've seen very good results with this way of eating, but it comprises whole foods. There are no processed or refined foods on the Mediterranean eating. And the nice thing is, it doesn't push out any food groups. There are many dietary plans there that will tell you not to have dairy, not to have wheat, not to have any starches or carbohydrates in the diet, not to have beans or lentils or whatever. And before you know it, you have a very narrow food mix and it's very hard to maintain. The Mediterranean allows you to eat most whole foods. Obviously, if you have a medical condition or have an allergy or a sensitivity to a food or an intolerance, so then you don't include it. But basically, it's a whole food eating plan. It's colorful. It's primarily based on a lot of colorful fruits and vegetables. It's not a low-fat way of eating, but they emphasize the right fats, healthy fats like avocado and nuts and seeds and olive oil and olives and the fat that's found in fish. So those kind of fats are a regular daily part of the Mediterranean eating. The proteins are primarily plant-based. They use more things like chickpeas and lentils and beans and things like that for the protein. And fish, of course, is a staple. Fish becomes a very important protein on that way of eating. They do use a lot of different herbs and seasonings and spices. And some of these herbs and seasonings are known to promote cognitive health and to stimulate circulation to the brain. So things like ginger and garlic and curry and some things like cayenne peppers and things of that type are very helpful to circulation. There's no refined sugars, no refined carbohydrates on this diet. So it really is a very well-balanced, healthy way of eating. And one of the things that we know is that there is a condition in the body called inflammation. Inflammation, researchers today believe, may be the root cause of many diseases that we see in our society. What do we mean by inflammation? We know that if we step off a curb and we sprain our ankle, it becomes inflamed, which is part of the healing process. That's normal. But if inflammation continues internally in the body, chronically, there's an immune response, and that immune response can start to damage cells in the body, even cells in the brain, to damage the blood vessels and so on. So the Mediterranean way of eating is an anti-inflammatory diet. It reduces inflammation in the body by using the healthy fats we mentioned, the whole foods, the colorful fruits and vegetables. It gives you an anti-inflammatory benefit. So that's a very important component, and that's why people who follow Mediterranean way of eating may lower their risk for Alzheimer's and dementia. Now, having said that, I know those are scary words to a lot of people. How many people here, by a show of hands, have had the following experience? You walk into, you're in a room and with other people, and you've been introduced to somebody, and a minute later, you can't remember the name. Raise your hands. Anybody ever have that happen? How many people sometimes will go into a room in your home or apartment and forget what you went in for? Okay, it happens all the time. And how many people have had this experience? You ask somebody to pass you something and you point to it and you say, can you please pass me that thingamajig over there? You might forget the name of an item. Okay, happens, right? So many people fear the worst when that happens. And most of the time, that's just a natural consequence of the aging process. Forgetting or the memory slips a little bit. And those are not really indications of Alzheimer's or dementia. Alzheimer's or dementia, when it becomes more serious, is really when you keep asking the same questions over and over and over again, or you get lost in familiar surroundings, or you forget how to use a toaster or some basic piece of equipment that you were always able to use. When you have those types of symptoms, you really have to consult with a medical expert to make a diagnosis and to get a treatment plan. And there are treatment plans. I want you to know that there are many different types of dementia. Alzheimer's is just one type of dementia. It's the more serious type because I don't believe there's a known cure for it currently. But there are other types of dementia that could be reversible. So you need a real expert in the area that can make the right diagnosis and get the right treatment plan. But the nature of the talk today is to see how we can strengthen our cognitive health and hopefully reduce the risks of developing dementia. Okay, having said that, we know there is a strong genetic component to dementia, but we also know the lifestyle component is also very powerful. And we know there's been a lot of research today that shows that when nerve cells or brain cells die, at one point we thought they can't regenerate, but animal studies have shown that animals can regenerate brain cells. And many researchers believe that human beings also have the ability to generate new brain cells. And we're going to talk about some of the things that we can do that can possibly do that. And we also want to talk about how to protect the brain cells that we currently have. So we showed you that outline before. I'm just going to run through some of the things that are on that outline. And one of the things I want to talk about is giving yourself a mental workout. A mental workout means to challenge your brain, to learn new skills. It's a lifelong process, but that mental workout is one of the ingredients that can help you develop new brain cells. So anytime you learn a new skill, you are strengthening your brain cells and possibly generating new brain cells. So it's very important to keep your brain active. How do you do that? Crossword puzzles, reading, learning a new skill. There are certain word games and board games that will stimulate your brain. Believe it or not, even bingo, even playing bingo can stimulate brain function. So there are many, many things you can do. Learning a new language, learning how to play chess, learning a musical instrument. The list goes on and on and on. In any event, it's something to keep in mind. Okay, somebody just flashed something on the screen. We could talk about that a little bit later, maybe. Okay, so that's something to keep in mind, to keep your brain active and to stimulate your brain as best you can. The next thing I want to talk about is something called antioxidants. Raise your hand if you heard of antioxidants. Okay, terrific. An antioxidant, for those of you that are not familiar with it, I'm just going to break down the word. Anti means against, and oxidant means oxygen. Anything that's against oxygen, works against oxygen, is an antioxidant. So let me give you an example. Oxygen is a good thing. We need it to stay alive. But oxygen also damages things. If you take a piece of iron that's not painted and you leave it out in the street for a certain amount of time, it's going to rust. That's called oxidation. Damage being done by oxygen is oxidation. I'm going to give you a homework assignment. Some of you may have already done this, but I'm going to give you a homework assignment. After this talk is over, I want you to cut open an apple if you have one in your house. And then you're going to take some fresh lemon, and on one half of that apple, you're going to squirt fresh lemon. On the other half, you're going to leave it the way it is. And in about a half hour, you know what's going to happen? The apple that didn't get the lemon juice on it is going to start to brown. It's going to start to brown out. That's oxidative damage. Before you cut open that apple, Hashem had it in a tightly knit package with skin around it, so the oxygen can't get to it. It's being protected. Once we open it up, oxygen gets to it and starts to damage it. But the side with the lemon juice is going to be unaffected. or it will be ineffective for a longer period of time because the lemon juice contains a very powerful antioxidant called vitamin C. And that works to protect the cells of the apple. And all I want to tell you is that if we have more antioxidants in our diet, in our foods, we will have better protection for our brain cells and for our blood vessels and for other cells in the body. They will be protected against the ravaging damage that oxygen could do to those cells. If our antioxidant intake is low, then we are more prone to oxidative damage and more of an inflammatory process like we spoke about before, and so on. So one of the things to do is to increase your antioxidants, and we do that through a Mediterranean way of eating. And for some of you, that might take a multivitamin mineral supplement. It comes along with vitamin C and vitamin E and selenium and other antioxidants as well. The next thing I'd like to talk a little bit about are the B vitamins. The B vitamins. The B vitamins are known to be important for the health of the brain, and things like folic acid, vitamin B6, vitamin B12. One of the things they do is they lower something called your homocysteine level. Homocysteine is an amino acid that sometimes builds up in the body, and the B vitamins help keep it in check. By keeping your homocysteine level low, it may protect the brain and the blood vessels and so on. So the doctors can check your homocysteine level, and if it's a little bit high, you might need some more of those B vitamins that we just spoke about. Medical conditions. Underlying medical conditions can directly affect the health of the brain. So if you have uncontrolled blood pressure or cholesterol numbers that are out of the range, or if you're diabetic and your blood sugars are not controlled, these kind of medical conditions, along with many, many others, could damage the brain and increase the risk for dementia. So I would suggest that you want to make sure that you monitor any underlying medical conditions and make sure the numbers are kept best in control. And that can sometimes be done through diet and lifestyle changes, and sometimes medicine may be needed as well. But I would take steps to address medical conditions, get regular screenings and checkups, and make sure those conditions are being well controlled. The next thing I want to talk briefly about is exercise. We know that the real benefit to physical exercise, we spoke a little bit about mental exercise before, but physical exercise and physical activity increases circulation to the brain. And we know that the brain needs good blood flow and a good supply of blood to bring nutrients and to take toxins away. So regular physical activity, you could speak to a professional that maybe can guide you on what might be best for you, but that certainly becomes very important. A brain without enough sleep is not going to function as well. How many people here have had the following experience? You didn't get any sleep one night. Raise your hand. Ever have that? Where you just go a whole night maybe without sleeping? How do you feel the next day? One night of not sleeping well. Before that one night, you could have had 10 years of solid, restful 7 or 8 hours of sleep a night, and then one night, just one night of not sleeping, and the next day you find it difficult to concentrate, you're more irritable, more moody, and it shows how important sleep becomes to mental functioning, cognitive functioning, the ability to concentrate, our mood, and so on. So I can't emphasize it enough, the importance of getting regular, good sleep. If you're not sleeping well, again, that could be due to a medical condition which has to be addressed with either a sleep specialist or somebody that could get to the cause of the problem. Sometimes it's due to hormones that are changing. It could be due to the room environment being too light or too hot. Some people sit down to a murder mystery before going to sleep, or they put on the news or something, and that's going to make it hard for you to go to sleep. There could be hundreds of reasons. There are over 100 different sleep disorders out there. Over the course of a lifetime, most people develop one or more different kind of sleep disorder, and it has to be addressed and, to get adequate sleep. Stress. Who doesn't have stress nowadays? Raise your hand. Anybody stress-free out there? Nope, okay. Anyway, a certain amount of stress is normal and healthy to some degree, but if we're overwhelmed by chronic stress or a chronic problem that we can't solve, it raises a certain hormone called cortisol. Cortisol is a hormone, it's called the stress hormone. And if that's elevated for a long enough period of time, it could shrink the hippocampus, and that's a small part of the brain in the back of the head where the memory is stored. So it can actually affect that high level of that hormone cortisol could affect your memory. So doing things to relax and reduce your stress are very important. There are many, many things that could be done. There's exercise, there's relaxation techniques. There's a book by Rabbi Pliskin called Gateway to Happiness, which is a cognitive approach to mental health. And I've looked through it myself many times, and it really gives some very good stress reduction techniques in there. So I'm sure it's still available, but that's something to consider as well. And then maybe even consulting a professional if you feel chronic stress and so on. Many times, medications could be the root cause of a short-term memory problem. For example, there were certain blood pressure medications. There were antihistamines. There were many different medications that could affect your short-term memory. So the first thing you need to do before you start a medicine or take a new medicine or whatever it is, ask the pharmacist or your doctor, does this have any effect on my short-term memory? I've known people that have started medications and have seen a direct effect on their short-term memory. So it has to be checked out and ruled out. The research also shows that people who have more social contacts, who nurture social contacts and are engaged with other people. Now, I know in today's world, many people are isolated. That's why these programs from the OU are so important, because at least you're bonding with a group, you're listening to something, and you're getting some mental stimulation. And it's very important to try to stay connected with people, with friends, with family, neighbors, whatever, even if it's over the phone, if you can't get out. But social contacts and staying socially active can reduce the risk, believe it or not, for Alzheimer's and for dementia. When they talk about stress, they have noticed that people who are more optimistic, have more of an optimistic outlook on life, are also less prone to Alzheimer's and dementia, because by being optimistic, you're usually controlling your stress better. So how do we become more optimistic? We have to work at it. It's an attitude. It takes a long time to really develop optimism, but one little exercise I could suggest at the end of the day, think about one or two things good that happened, something positive that happened. We're very prone to focus on what went wrong that day, on the negative. But if you focus on the one or two positive things, you get into the habit of doing that, then you're sort of switching the channel from being more negative to more positive. But it's good for reducing stress. Hobbies and volunteer work are also critical for cognitive health and building a cognitive reserve. Again, they say people who have hobbies and things they like to do and spend time doing, or do some sort of volunteer work, or even paid work, if it's enjoyable and interesting to you, is a good way to reduce the risk of Alzheimer's as well. Okay, so those are, we touched on many of the things in the outline, and again, I just wanted to talk a little bit more about foods. There's a food, there's an omega-3 oil. Omega-3 oil has been shown to be very important for the health of the brain. As a matter of fact, the brain is made up, a lot of the brain is made up of fatty tissue. And the fatty tissue that makes up the brain is actually omega-3. So when you're eating foods that contain omega-3 fats, you're really feeding the brain. You're really feeding the brain. So what I would suggest is try to increase your fish intake. In my experience as a nutritionist, many of my patients, when I do my intake, I find that they're primarily chicken and meat eaters. And fish sometimes finds its way in, but not as often as some of those other kinds of animal proteins. So we saw in the outline from Harvard publications, we want to try to be more plant-based. We want to cut back a little bit on the animal protein. And when we do make animal protein choices, see if you could trade off the red meat for a fish dish. Okay, it could be fresh fish, it could be frozen fish, it could be canned fish. In the can, I would say salmon or sardines would probably be a better choice than tuna. Tuna is a little bit higher in the mercury. Once in a while it can fit in, but I would opt for some of the others. Also, you could choose fish like salmon, halibut, haddock, cod, scrod, fillet of sole. Those are all good choices, and I would try to include them in the diet. Flax oil is another way to get some omega-3 in. The body has to convert it into the omega-3 fats. And there's also ground flax seeds. You could buy flax seeds, grind them up, and add a tablespoon or two to your oatmeal cereal or onto a salad or into soup or whatever. You can get a little omega-3 that way also. Dark green leafy vegetables, certain nuts like walnuts actually are one of the few nuts that contain omega-3 oil. As a matter of fact, if you open the shell of a walnut, you know what it looks like? It actually looks like the brain. It has the two hemispheres, like the right and left, and it's divided in the middle there, and it actually looks like a human brain. And I don't know how scientific this is, but there is a school of thought that if it looks like an organ in the body, it may be good for that organ. And it turns out it works at least for walnuts because they do resemble the brain, and the research shows that they do provide a good fat, a healthy fat that actually is good for the brain. So these are some of the things that you want to keep in mind. In addition to that, we mentioned the importance of keeping the diet colorful. Rebbitzin Steinig is going to send you a handout that I prepared for this talk, which will give you a summary of those different kinds of foods and some other information as well. But basically, things like berries, blueberries, strawberries. They did some very interesting research where they took two groups of rats. One group got regular rat food. I don't know exactly what that is, probably cheese. That's what they eat, I think. So they got cheese, and the other group of rats were fed blueberries, strawberries, and spinach. And after a certain number of weeks or months of these diets, they put those different groups of rats through a maze. And you'll never guess which group got through faster. You probably will guess. The ones that had the blueberries, the strawberries, and the spinach. These very powerful antioxidants in these foods protect the cells of the brain and reduce the oxidative damage that may be done to the brain and the blood vessels. And that's why they become so important to us. And it's never too late. All of these things I mentioned in that outline all have research behind them to show that they can reduce our risks of developing Alzheimer's and dementia, and can also help the brain function at its optimal. When it comes to supplements, supplements have to be done wisely. Sometimes people can overdo supplements. I told the story the last time I was on and we did a talk on the immune system. about a patient I had many years ago. I always tell my patients to bring me the supplements. I want to see what they're taking. And anyway, okay, somebody just told me that rat food are pellets of not cheese, but grains or something of that effect. Okay, so in any event, the patient came with a suitcase, opened it up, and there were 40 bottles in there. 40 bottles of different vitamins and minerals that the person takes every day. The first question I had was, how long does it take you to take those supplements? He told me 20 minutes. That's a long time, 20 minutes, to open and close bottles and swallow supplements. So I said, I'm not even going to, right now, without even looking at them, I could tell you you are overdoing it. And even though supplements could play a role, if we're missing certain nutrients that are important for the body or for the brain to use to make the neurotransmitters that we spoke about, and to control homocysteine levels and things of that nature, then a supplement, if it shores up a nutritional deficiency, and it gives us some extra antioxidants, it may not be a bad thing. But too much of a good thing is not good either. So I'm not in a position in this format to make specific recommendations or to tell you how much to take of different things, because keep in mind, supplements could interact with a medical condition and possibly with a medicine you're taking as well. So I would discuss with a healthcare professional, a nutritionist, somebody who's knowledgeable and could advise you on what might be an appropriate supplement program. I know with my patients, I do a thorough evaluation of their eating habits, their nutritional status, their lifestyle, medical history, and then, you know, I could put together what I think might be a more sensible plan. If I see, for example, that a person doesn't eat fish, they're allergic to fish, or they don't like fish, so I have to look for a way that they could bolster their omega-3 intake. Or if I feel they're missing certain major food groups, or they're not getting enough B vitamins or vitamin C, or some of the other minerals that might be important to general health, immune health, health of the brain. So we could make suggestions on how they could get more of those things in. So that becomes very important as well. Okay, basically, I think what we've done so far, we have covered a good part of the outline of the things I wanted to talk about. What I think we could do is let's at least try for now to maybe open up to some questions. Before I do that, I just want to make one point. Okay, so somebody just sent me a question. Question is, what is the relationship between the Mediterranean diet and I think it was the anti-inflammatory diet? I would imagine there is a great overlap between those two kinds of meal plans, because anything that's anti-inflammatory has to include the kind of foods that a Mediterranean meal plan would include. Again, you want your meal plan to be varied. You want it to be colorful. One of the things I do when I evaluate my patients, and I have them keep a food diary, I'll go through 5 days or a week of eating with them, and I'll say, you don't have anything orange in this meal plan, or you don't have anything green or purple. In my book, I talk about, in the book L'chaim, 18 Chapters to Live By, we talk about the colors of different foods and the various nutrients you get from those foods. I also want to tell you, when it comes to anti-inflammatory meal plans and foods, besides the vitamins and minerals that we depend on, and the protein and the fats and the carbohydrates that we depend on from our foods, there's something else in foods called phytochemicals, phytonutrients. They've identified approximately 10,000 different phytochemicals or phytonutrients that are in foods. Those are the chemical ingredients in foods that give food its color, its texture, and its taste. Out of those 10,000, only about 100 have been studied. And I'm going to give you some examples to what they are. The ones that have been more readily studied are things like beta carotene. That's what makes the carrot orange. That's what makes the sweet potato orange. It's the plant chemical, the chemical in the food, beta carotene, which gives the food the orange color. They've discovered that the various colors each add a certain dimension to our health and to the health of the cells of the body and so on. So you could be getting a lot of vitamins and minerals, but you could be missing colors, and that could be detrimental. So the Mediterranean food plan is a varied plan made up of, like I said, of many different colorful fruits and vegetables. So getting the greens and the orange and the yellow and the red. The more the diet looks like a rainbow, the more protection you're going to have against the damage that oxygen does, the more nutrients you're going to get, and you're going to benefit from all those plant chemicals. Other examples of plant chemicals, lycopene, lutein, which you know is good for the eyes. Again, anything that promotes cardiovascular health is going to promote brain health as well. And the Mediterranean diet does both beautifully. Again, made up of whole foods, colorful foods, healthy fats, fish, nuts and seeds, olive oil, some dairy. There is some dairy on it, usually cultured dairy, like kefir or yogurt or things like that. Eggs and chicken are part of it, but not, they're not used excessively. Red meat is used least. And when animal proteins are used, they are the side dish, not the main dish, okay? And fish is maybe used a little bit more regularly, but more importantly are the plant proteins we mentioned, coming from lentils and beans and other plant sources of protein. Soy proteins like tofu, tempeh. There's something called edamame. Those are the real soybeans. Just a week or two ago, I bought something called riced edamame, where they dice up the edamame beans into little particles, and it's in the frozen section at the supermarket. And it's a nice way to add some plant protein to your meals also. Nuts and seeds, flax seeds, sunflower seeds, pumpkin seeds, almonds. Those are also sources of protein that could be put into your meal plans. Okay, let's.
We have a few questions,
okay.
Dr. Shmuel, that came to me. So some of them are quick, and you probably have more that came to you. Okay, so the first one is, what kind of a medical specialist would we see if we suspect dementia? Is that a neurologist, a geriatrician? What
Okay.
kind of?
I would say probably a neurologist or a psychiatrist, possibly a geriatrician also would be a good choice. But the neurologist or possibly psychiatrist would maybe have more of a specialty. And you may even want to do a little research. There are organizations like ECHO and other medical referral organizations that can possibly direct you to a doctor that might not only be a neurologist, but may have a specialty in dementia. So that would be possibly a good way to do it.
Okay, a couple of others. Okay, is it ever too late to start, I guess, any of these strategies that you've had? And also, these are kind of all combined. How can you get B12 from a vegan diet? And do you recommend a multivitamin? And they also want to know what the vegan sources are. Okay.
Okay. So again, it's never too late. Never too late. We've seen men in their 90s develop muscle tone equivalent to men in their 50s by putting them on a training program. So again, if you could affect in a positive way the physical health of the body, either indirectly or directly, you'll be affecting the cognitive functioning of the brain in a beneficial way. So I don't think it's ever too late. Number one, to combine the dietary and lifestyle factors that we spoke about. Okay, so as far as B12, let's see, this is a real test for my memory. I got to remember all those questions, okay? So anyway, as far as the B12 goes, a little bit harder for a vegan who doesn't have any animal products to get the B12. They may have to rely, if they're deficient, I would make sure you get a check for your B12 level, because if you are deficient in B12, it could produce symptoms that look like a person has Alzheimer's. And it could be just a B12 deficiency. And I sometimes wonder how many people never get checked and are diagnosed with something they don't really have and could be possibly corrected with B12 protocol. So I would say check your B12 level. If you are low, So then you have to discuss with your healthcare professional the best way to get you in the range. It could be through oral supplementation or B12 injections, or increasing the use of B12 fortified foods or B12 rich foods. Keep in mind that as we get older, it is harder to absorb vitamin B12 from the gut because we have less hydrochloric acid, which is needed to absorb B12. But in a supplement form, it becomes, it's in a crystal form, it becomes more absorbable. So it's something for your healthcare provider to discuss with you. Okay. Any other questions?
The next one was do you recommend a multivitamin? And then the last one was, there's more coming though. Something they just asked, vegan sources. So
Yeah. So as far as a multivitamin goes, I could tell you they're not all created equal. I've done a lot of research, and I feel my answer is, my short answer is that if it's a well-balanced, well-made multivitamin supplement, I think it could play a role, and it's probably not a bad idea. Finding a good quality multi-supplement might be a little more challenging. If anybody wants to contact me or my office, maybe we can guide you, give you more guidelines, and maybe make some suggestions for you. But it's probably not a bad idea, because you got to keep in mind, most people probably have some deficiency, subclinical deficiency in some nutrients. Certainly most people are deficient in vitamin D. As we get older, B12 could be deficient. Older adults are sometimes deficient in zinc, the B vitamins, iron. So trying to correct deficiencies with your foods is always the best place to start, because when you're using foods, you're also getting the synergistic benefits of the phytonutrients, the other vitamins and minerals that are in the food, the protein, and it's probably going to be best absorbed and used by the body. Having said that, there still could be a need for a good multivitamin mineral supplement, and for some people, other supplements too, whether it's, calcium or magnesium or extra vitamin D, but that all has to be determined based on, an evaluation and possibly some vitamin and mineral testing and so on.
okay, couple things. Oh, a comment was made that a neuropsychologist can do testing on cognitive functions at all ages. So that's from one of our viewers. Thank you.
Okay.
Okay, next question. Does organic food make a substantial difference in eating fruits and vegetables? Well, with the peel, is it better with no peel?
Okay.
Peel versus no peel.
Yeah, it's a good question, and I'm sure there's different schools of thought on it. I would say that if you wash things well, will you get all the things off and all the chemicals that could be in the skin or the fruit out? I don't know, but you can clean things up very well. They do make some very good fruit and vegetable washes that could and should be used to clean fruits and vegetables. If you have access to organic produce and you want to make use of it, I certainly would not discourage you. I think it's probably a good idea. Might be a little bit more pricey, but I could tell you, I recently started buying organic apples. They are more expensive, but the taste is like almost night and day, at least from some of the ones I've tried. Big difference in taste. If it really is organic, I do think it's probably a better quality food item. But if you don't have access to it or you don't have the budget for it, I certainly wouldn't stop eating regular fruits and vegetables that are not organic. I would just try to wash them well, and I would still make use of them. And I'll just give you another tip since we're on the topic. Don't be afraid to use frozen vegetables, because the frozen vegetables may preserve their nutrients more than the fresh because they're frozen right away. Today, fresh might not be so fresh. It comes off of a farm, it's pulled out of the ground, it's on a truck, it's on a warehouse, it gets to the supermarket, sits there for a couple of days. You buy that spinach, it sits in your refrigerator for a couple of days. By the time you eat that fresh spinach, it could technically be a week and a half or 2 weeks old. One day after it's pulled out of the ground, it could lose 50% of its vitamin C content. That same head of spinach frozen, it's frozen right away. It may preserve its nutrients better. You'll have less waste. I'm not discouraging the use of fresh fruits and vegetables, but I would also rely on frozen, and I would use both, and I would try to increase your fruit and vegetable intake and the colors that we mentioned earlier as well.
Okay. Somebody brought up a comment. I think this is interesting. They said the Jewish Family Services in Stamford, Connecticut has a program called Brain Fitness, which they said is wonderful. Perhaps people could get in touch and say, I don't know if they're doing anything virtually now, but it's always good to look for resources within your community. Okay, next. Okay, are there any supplements to protect from catching or lessening symptoms of COVID? And that was one comment from somebody. And the person also says that he has difficult doing more than one thing at a time. He's in his 70s. And is that a symptom of the brain slowing down, or, is it just his thing? So it's two questions. One about supplements for COVID, which,
okay.
and multitasking.
Okay. So as far as supplements for COVID, I don't know of anything scientifically documented that's going to prevent COVID. Having said that, I could tell you if you do have a nutrient deficiency, like let's say you come up short on zinc or vitamin C or some of the nutrients that are important for immune health, your immune system will be compromised and you could be more vulnerable not only to COVID, but to a cold, flu, a bacterial infection. So I would say anything that could be done to bolster immunity by better eating and by many of the things we spoke about even in this talk will be helpful. In my book, I do have a chapter on immunity and things of that nature, which will give you some other ideas. But I would say bolstering immunity becomes very important, especially as we go into this particular season. And the other thing on multitasking, again, that's not really my area of expertise, but I think it's probably somewhat normal for things to slow down a little bit as we age. But I would probably address that symptom if there's concern about it with maybe a healthcare expert who specializes in that area.
Okay, I have no other questions. Oh wait, sorry, something just came up. Oh, somebody's just making a comment about multitasking. And I believe that when we had our program with Rena Yudkowsky, she definitely did not, on memory, we had a 3-part series earlier in the summer, and she definitely did not like multitasking. So people can visit that in the archives. I think that's it for the questions I have. Dr. Shields, do you have anything else?
The only thing I just want to close with just a couple of comments. First of all, I want to again thank everybody for taking the time. I know it's a very busy time to participate, and I enjoyed doing this program. I know we're heading into Yom Kippur, so I just want to maybe just say something very briefly. We know that tshuva, tefillah, and tzedakah can overturn a bad decree, and we also know that Kol Yisrael, Arevin Zeh Lezeh, we're all connected with one another. So your tshuva and your tefillah and your tzedakah are going to help each and every one of us. So hopefully as we go into this very challenging season, we should all see if we could do the best we can in those 3 areas to help all of us out. The last thing I want to say is my book is available only through me, called L'chaim, 18 Chapters to Live By. It's a wonderful book. It has an endorsement by Rabbi Shmuel Kamenetsky and many, many other rabbis. It's a book on health from a Torah perspective. It's a wonderful book. It's readable, it's practical, it's an enjoyable book to read. You'll get a lot out of it. Each chapter is devoted to another aspect of health, how to control blood sugar, the immune system, weight management, how to prepare healthier meals and snacks. Great book for if you want to keep your grandchildren, your children healthy. There's a lot in there, and it's available through me, and you'll get information on it. Thank you all for joining. Thank you, Rebbetzin Steinig, and thank the OU for this wonderful program.
Thank you, Dr. Shields. We really appreciate all the insights you gave us, the inspiration, and the practical suggestions that I think will be helpful to everybody. A few announcements. Everybody should have received a survey. I think it came through my email address, First of all, we want to thank everybody that has filled it out already. Over 400 people have filled out the survey, but we have many, many more to go. And we really need the insights and the information that you will provide to us. So if you could please spend a few minutes on it today. Look, it was sent this past week, I believe it was Monday. So if you could look at your emails, we really would appreciate all of your feedback. At this time, as everybody is preparing tzedakah, we ask you to please consider the Spirit program, because your generosity helps the OU continue all of its vital quality programs. So there's a donate button on all the emails that you've been getting. So you can just click that for an online contribution. Otherwise, if you're not comfortable contributing online, you can also make out a check, and the information for where to send the check, just put on it that it's for the Spirit program. If you can let me know that you sent it, we can also be watching to track it. Okay, next thing is to let you know that Spirit will be on vacation until Tuesday, October 13th. So during that time, it gives you plenty of time to go back to the archives if you've missed anything, and everything will be up and running. So we want you to look there. And there's a lot coming on the next month. Believe me, we are fully planned out through, I think, the middle of November right now, and more things coming up. I want to remind everyone that I had mentioned that it's November 10th and 12th, which is the anniversaries of Kristallnacht, and it's also Veterans Day that week. And we would love to hear from anybody of our viewers who is either a survivor of the Holocaust or a child of a survivor, or anyone who has served in any capacity in the military. We'll be sending out a form within the next week or two if you're interested in participating, because we'd like to hear from you what your experiences have been. I think that would be very helpful to everyone. And that's it. So have a wonderful day, have a good Shabbos, and a meaningful Tainus on Yom Kippur. Gemar Chasima Tova, wishing everybody a joyous, peaceful, and healthy New Year. Thank you so much.
Thank you.